few questions for you. If I'm seeing a parent, or you're seeing a parent who is concerned that their child's doing motor tics or verbal tics, or might have Tourette's disorder, how do they know, or with whom should they speak about those concerns?
Well, first of all, I think it's important to understand that many children, 20–25% of children by some estimates, will have tics at some point in their life. Usually they'll go away. Most cases they go away. I mean, when you think about how common Tourette's is in the general population, maybe 0.5% to 1% have Tourette's at the most. And so when 25% of children have tics at some point and only 1% actually have Tourette's, the chances are that even if your child is showing some tics, they won't end up developing Tourette's. It's a very common kind of part of development, having tics. That said, if the tics happen for more than 4 or 5 weeks continuously, it's probably worth going in to get it checked. I would typically start by going to a pediatrician, and then you can probably expect to get referred to a pediatric neurologist or a psychiatrist at that point. And that's useful to make sure you have ruled out any other problems. Typically, you won't have to get like an MRI or an EEG. There are no diagnostic tests for Tourette's. It's simply just going in and having someone look at it and make sure that it's a tic and not some other kind of condition.
So if a parent finds out that their child does have Tourette's or has a tic disorder, what's the next step for them? What should they do?
Sure. Well, in many cases, I mean, I think it's important to understand again that Tourette's disorder is really only just tics. A lot of people get very nervous when they hear Tourette's. They think it's worse than just having tics. But really, Tourette's is tics. It just means you have 2 motor tics and a vocal tic for at least a year. There are other tic disorders like chronic tics or transient tics that are also just tics, but they're happening for less periods of time usually. So when you get a tic disorder diagnosis, Tourette's or any other tic disorder diagnosis, it doesn't necessarily mean that you need treatment. Many children with Tourette's diagnosis don't need treatment for their tics. Their tics are there, but they're not really affecting the child at all. And in that case, they really don't need intervention. Was that the answer to your question? I can't remember if you asked another one, another part of that.
So how does a parent decide if their child does need treatment?
Sure. The thing to think about is your child being affected by the tics? Are the tics causing pain? Are they causing the child to get teased? Are they affecting the child's school or social life? Are they affecting the family negatively? That's when it's time to go seek help. If any of those things are in place, then it's time to get the tics looked at for treatment.
Okay. So if a parent decides that they do need to get treatment for their child's tics, what treatment options exist? And I imagine there are a lot of treatment options that exist, but how does a parent know if they're getting effective treatment for their child's tics?
Well, one of the things a parent could do for a child who's just diagnosed is go to the Tourette Syndrome Association website. There are lots of resources there to describe to parents what effective treatments are out there and what are available. And also what treatments that have been proposed for Tourette's may not work. Because there are a lot of other treatments out there, alternative treatments that are put out there as effective but aren't really effective or haven't been tested. What kinds of treatments should people be looking for? Hopefully every treatment starts with education, educating the parent about the symptom. And if we're talking about medical treatments, people will usually try drugs like clonidine or guanfacine or later on maybe Risperdal or Orap or Haldol at the most extreme cases. So that's usually where treatment would start. Behavior therapy, as we talked about in the video, can be very effective. It's probably a little harder to get because it's newer and people are trying to learn the treatment procedures, not as established as the medication treatments, but even though it may be as effective. So that's really what people would expect from seeking treatment.
Okay. Let's talk first about medication and then maybe talk a bit about behavior therapy. So you mentioned several different medications and you said that they're effective in treating tics, meaning they reduce the tics? Okay.
Medications, just like behavior therapy, aren't cures, they're management strategies. They're ways to bring the tics down and reduce the frequency of tics. Sometimes they can be very effective in reducing the tics greatly, but that doesn't mean the tics are cured or gone. Sometimes they aren't as effective, and behavior therapy functions the same way.
And are there any risks associated with medication?
With medication, there are a number, depending on the type of medication, there are side effects. Common side effects of many of the medications include fatigue, Weight gain is a big one, especially for a drug like risperidone. It seems to be a bigger problem for that medication. Feeling of cognitive dulling, like your head's in sort of a cloud and you're in a haze sort of thing. Those are some of the bigger side effects that people will experience from these drugs.
So it sounds like families need to make the decision while working very closely with the treatment provider, and it's something that they have to weigh the costs and the benefits.
Absolutely, and a good treatment provider won't rush right to prescribe. They'll have you think through that, whether the risk of putting the child on the medication is worth it compared to how much impairment the tics are actually causing, for sure.
So then you said the other type of treatment for treating tics is behavior therapy. Can you tell me a little bit what behavior therapy is?
Sure. Behavior therapy is a broad term. Behavior therapy essentially means looking at the environment, and what I mean by environment is the context or the world that the child's in, and seeing how different factors in that child's life are impacting the tics, making the tics more or less likely to happen. And what we're really interested in doing in behavior therapy is finding the factors that are making the tics worse and changing the environment in a way to bring the tics a little bit more under control.
So again, it sounds like you're not going to get rid of tics entirely, but you might make them more manageable.
Exactly. Behavior therapy, like medication, is a tool to manage tics. It's not a cure. Now, when we have children on behavior therapy, often you'll see great reductions in the tics to the point where the tics are very, very, very mild and sometimes even unnoticeable. To say that we've cured the underlying biology, I think, would be incorrect.
Okay. Now, we talked about risk factors associated with medication. Are there risk factors associated with behavior therapy?
There don't seem to be any negative side effects of behavior therapy that we can really see. Sure, things happen to individuals, but on the whole, when we're looking at behavior therapy, we see a pretty safe treatment. It doesn't really seem to be associated with any side effects.
So again, it sounds like parents need to work with a treatment provider to weigh the costs and the benefits.
Absolutely.
Okay.
Absolutely.
So if a parent does decide to pursue behavior therapy, how do they know if their treatment provider is doing good behavior therapy? Like, what does it look like? What should a parent look for?
Sure. Well, that's a great question, because there are a lot of therapists out there who claim to be cognitive behavior therapists or CBT trained or things like that. And I'm always a little skeptical when I hear that, because what I see some people do and call CBT is not what cognitive behavior therapy really should look like. So that's a great question. How do you know if someone who you're trying to see has been trained in behavior therapy? You should look for a couple key words, first of all, and you should actually interview your care provider, just like you interview anybody else you're hiring for a job. You should ask, are they trained in behavior therapy? Are they trained in habit reversal training? That you should use those specific words, HRT or habit reversal. Have they been trained in that procedure? Have they been trained in CBIT, comprehensive behavioral intervention for tics? And if they say no to all three of those, run away.
Okay.
If they say yes to behavior therapy, you might have a chance. If they say yes to habit reversal or CBIT, then you've found definitely the person you want to work with. If you find somebody who's just trained in behavior therapy, the next thing to ask for is, are they trained in OCD treatment, exposure and response prevention? If they are, they'll be able to pick this up pretty quickly. Now, another way to do this is actually to contact the Tourette Syndrome Association. They do maintain a list of people who've been trained in CBIT, and so they might be able to give you the name of somebody in your state or region who's able to do this and who's been trained.
So a lot of the parents that I speak with, when they describe going to get treatment or going to therapy, the way they describe it is, they'll go to a treatment provider, their child goes into a room with a therapist for maybe 50 minutes, and they wait for them. They feel a little in the dark about what's happening. Is that what a parent should expect with behavioral therapy?
Behavior therapy for tics, what you should really expect is the treatment that we've developed, you should expect to put in at least 8 sessions. We ask when parents come in, expect to come in 8 sessions. The first couple sessions will be a little longer, about 90 minutes, and the rest of the sessions will be 50 to 60 minutes. So that's what you should really bank on. Now, what you can expect when you get to treatment, it really depends on the age of your child, but in almost all cases, you can expect to be involved in sessions at some level. When I do treatment, the younger the child, the younger children, parents are there the whole time. And they're in for every session. They're participating. They're doing work right alongside the child. It's everybody's game when it comes time for therapy. As the child gets a little older, when we start talking about teenagers, parents are still in there every session at some point, and they're still doing some work, but they may not sit in the whole session as we progress through therapy. Now, it's important, I mean, people have their perceptions of what therapy is. They think I'm going to go lay on a couch and talk about my problems, and the therapist will sit behind me and listen and take notes. This isn't that, okay? This is really much more active. You can almost think of your therapist as a coach. They're kind of helping you through, teaching you the skills you need to have to manage this. And people you have to come into that understanding that that's what it's going to be about. It's not going to be all talking about your problems the whole time. It's really much more of a hands-on, this is how we're going to proceed here.
It almost sounds like it involves a lot of practice.
It is. It's a lot of work. I mean, keep in mind that, this is teaching a child new skills. Just like when you learn to ride a bicycle, you're learning how to do a new skill. It takes a lot of work and practice and repeating it to get the skill down, and that's when your brain changes and you learn how to ride a bicycle. This is very much the same thing.
So it sounds like it's a lot of practice. What are some of the actual skills that a child and a parent are practicing when they're not with their therapist or with their treatment provider?
Well, the two main sets of skills we're practicing are these. In the first, what we're trying to teach parents and the child is to recognize what in their environment makes their tics worse. To identify specific things that are happening in their world that are associated with increases in tics, and then teaching them how to change those things. Teaching them to create an environment that's more tic neutral, so to speak. So that's one thing, and that's pretty broad, but that's a skill that they learn over time. And another skill is learning how to stop their tics when they've started. So what we remember, again, what we teach parents is, or we teach the children and the parents help, is we teach the child to become aware of when they're ticking or are about to tic. And what we mean when we say about to tic, we're teaching them to be aware of that urge to tic. And once they become aware of that, we're teaching them to do a competing response, a behavior that the child can do that physically stops the tic from happening whenever they notice the urge or they even start to do the tic. And we ask the child to hold that competing behavior for a minute or until the feeling goes away, whichever takes longer. Now the child's asked to do this throughout the day during their treatment. It's not just 10 minutes a day or anything like that. It's every time the tic happens or is about to happen, which at first can feel very frequent, and then it usually feels a lot less frequent after a few days because the tic has dropped so much. Now the parent's role in that is to support the child, understanding the empathy that's necessary because the child's trying to change their own brain. They're learning how to ride the bike. It's a frustrating thing. The parent's job is to remind the child to use the competing behavior when they see the child do the tic, but not use the competing exercise. And the parent is also asked to praise the child and let the child know that they're doing a good job if the child is seen doing the competing behavior when the tic starts. So those are the big roles. That's really what happens week to week as the parent progress through treatment.
It sounds like it's a really active treatment, but that parents need the guidance of a skilled mental health provider to help in teaching those skills and guiding them as the child and the parent learn the skills, but that they take it over eventually? Absolutely.
It sounds very simple. And once you understand the principles, it can be a lot easier. But to really do this right, you need to have the guidance of a skilled, trained practitioner. And ultimately what our goal in treatment is to make the therapist unnecessary. We want to have the child and the family understand exactly what they need to do to manage the tics. It wouldn't be a very good treatment if they needed to keep seeing us forever and ever and ever. Ultimately, if we're teaching them a skill, once they have the skill, they don't need us anymore. And that's really what the goal of intervention is.
Okay. It's a different way of thinking about treatment.
Yes. It is.
So we've talked a lot about medication treatment, behavior therapy treatment, and CBIT treatment. We've talked about what a parent should look for in a treatment provider. Are there other take-home messages or things we haven't commented on that you think would be helpful for parents to know?
I think, and this might be true for every parent of a child who has some kind of disability, I think one of the biggest concerns I see, one of the things that concerns me most, I guess would be a better way to put it, is when parents start treating their children differently simply because of the disorder. They let them get away with things that they don't need to because of the disorder. They start making excuses for the child because of the disorder. Now, in some cases, it's legitimate. You know, if your child's getting teased, you've got to do something. You've got to intervene. But I think to help the child the most, you need to understand that the condition they have is neurological. It's not their fault. It's not something they're trying to do. But you also have to have expectations of the child. You have to make sure, for example, if a child has a swearing tic and they swear in class or call somebody a name or insult somebody, you know, you still have to make the child understand that even though they couldn't control doing that, that they have a responsibility to clean up that situation, for example. So I think, you know, that's kind of the take-home message is make sure your child will grow to be a responsible adult. Make sure that they are, you know, even if they're not held accountable for the tic itself, they are accountable for the damage that it might create. They are accountable for the disruption that it might cause. Even though the disruption is not their fault, they are responsible for cleaning up that kind of situation. If you do that, you'll end up creating a child that's very responsible as an adult and a very productive member of society. So I think that's one of the things I would really point out.
Okay, fantastic. Anything else to mention?
I don't think so.
Well, thank you for your time. This is really helpful, I'm sure, for parents to hear from one of the leading experts in the world for the treatment of tics and Tourette's. So we appreciate you coming here.
Thank you very much.
You're welcome.